Hello everyone. Um, in this video, we are going to discuss one of the most important steps in digital orthodontic workflow, that is the intraoral scanning. A high quality scan is the foundation of a successful clear aligner treatment. Whether you are planning for tooth movement, fabricating aligners, or printing 3D models, everything depends upon the accuracy of your digital scan. And in this lecture, we will cover what is an intraoral scan, then advantages over conventional impression, components of an intraoral scanner, patient's preparation, step-by-step scanning technique, common scanning errors, and clinical tips for obtaining accurate scan. So the first step is we should know what is an intraoral scan and a scanner. So, intraoral scanner is a digital device that actually captures thousands of images of the teeth and soft tissue and combines them into highly accurate three-dimensional digital model. Technically, it is called as a stitching of images. Unlike the conventional impression, where the impression material is placed in the patient's mouth, an intraoral scanner records the dental arches using optical technology. The scanner projects light onto the teeth, and sophisticated software reconstructs the surface into a digital model. The final output is usually an STL file, which can be used for clear aligners, crowns, implants, retainers, digital smile design, and 3D printing. And the advantage of intraoral scanner is that first it provides a greater patient's comfort by eliminating the impression trace and impression material, making it particularly useful for patients with a strong gag reflex. Second is that the scans can be viewed immediately on the computer screen. So if an area is missing, it can simply be rescanned instead of repeating the entire impression. And third is very important advantage is that the digital impression improves communication with the laboratories because files can be uploaded instantly without shipping physical models. And then also, digital records require no storage spaces, reduce material cost over time, and integrate seamlessly with the 3D printing and clear aligner treatment planning. What are the components of intraoral scanner? Although the different brands have unique design, most scanners include similar components. One is the scanner wand, captures the image inside the mouth. Then we have the camera system that records thousands of photographs every second. The light source, usually a LED or a structured light, illuminates the teeth for accurate image capture. And then the computer and a scanning software processes the image into a digital 3D model into the real time. Finally, the software allows the clinician to inspect the scan, trim unnecessary areas, and check occlusion and export the models as an STL file. Uh, Now, next is the patient's preparation before scanning. So, obviously, successful scanning begins before the scanner enters into the patient's mouth. The teeth should be clean, free of plaque, calculus, blood, and food debris. Excessive saliva should be controlled using suction, cotton rolls, and air drying because saliva reflections can reduce the scan accuracy. And good soft tissue retraction is usually important. Cheek retractors can be particularly helpful. Mirrors and gentle tongue control helps exposure of all the tooth surface. Then we have the patient should be seated comfortably with adequate lighting, and the clinician should explain the procedure before beginning. Proper patient's cooperation reduces movement and improves the scanning efficiency. Let us look into the step-by-step scanning technique. The most manufacturers recommend following a systematic scanning path, uh, which begins with the occlusal surface of the posterior teeth and slowly moves towards the anterior region while maintaining a constant distance from the teeth. Next, the lingual or parietal surface followed by the buccal surface. I repeat the same sequence for the opposite arch. And finally, record the buccal bite while the patient bites in maximum intercuspation. This allows the software to actually relate the upper and lower arches. Then one should avoid rapid hand movements or repeatedly changing scanning directions, as these may produce stitching errors or incomplete digital models. Uh, what are the common errors that are encountered during scanning, and what one should do to avoid them? So first, we have even experienced clinician encounter scanning errors. So there is no nothing to panic about. The most common mistakes include scanning is done too quickly, so failing to capture the distal surfaces of the last molars, or if there is excessive saliva contamination, incomplete bite registration, or a poor soft tissue retraction. So always inspect the digital models before accepting the scan. Look for holes, missing areas, overlapping images, or distortions. If any defects are present, simply rescan the affected area before exporting the file. And remember, every error in the scan will be translated to the treatment plan, transferred to the treatment plan. So eventually to the final aligners. Here are some few practical tips that should be kept in mind while taking a scan. Follow the same scanning sequence for every patient. Keep the scanner tip clean throughout the procedure. Maintain a steady scanning speed. Keep the fields dry and well retracted. Review the scan carefully before exporting the STL file. And although intraoral scanning is the first and most important step in digital orthodontics, and an accurate scan leads to accurate treatment planning, precise 3D printing, and well fitting clear aligners. So that's it. If we keep all these things in mind, we'll be able to take a nice intraoral scan, which is free of distortions and good for printing our aligners. Thank you.